Hello, hello. Thank you for joining us for a panel discussion on deciding to get the vaccine or not deciding to get the vaccine. My name is Winnie King. I'm the Senior Vice President and Chief of Communications, Inclusion, Diversity, and Equity at Cook Children's Healthcare Center. Now that the CDC has given the green light for children 12 and above to get the vaccine, a lot of families have to make some decisions. They've got to make decisions on whether they will be getting the vaccine and what they're going to be doing with their children and how are they going to help their children or if they're going to allow the vaccine for their kids. Let's see if we can provide on this panel some information that will help you make a decision and help you with that decision-making process. Joining me today is a distinguished panel of community leaders to help us walk through their own decision in making their decision-making process on getting the vaccine. So please allow me to introduce to you who you see on the screen today. First, we have Misty Wilder, who's the program director at Healthy Start, UNT Health Sciences Center. We have Imam Sadid Purcell, counselor, consultant for Convert Education, Islamic Center in Irving. We have Reverend Bruce D. Datcher, the pastor of Ebenezer Baptist Church and president of the Texas State Missionary Baptist Convention. We also have Dr. Ana Rios, medical director of antimicrobial stewardship, easy for me to say, in infectious diseases here at Cook Children's. We also have joining us Jerletha McDonald, founder and CEO of Arlington, Dallas, Fort Worth Family Child Care Network. And last but absolutely not least is Jim Davis, Chief of the Fort Worth Fire Department. Please let me say thank you and welcome to every one of you for being a part of this panel today. I'd like to jump right in. I'd like to understand how you made the decision, or if you've made the decision to get the vaccine. And I'm going to start with Jerletha because we had a little bit of a conversation right before we came on air. And I'd really like you to tell your story about the vaccine and how you plan on going.
Well, to be honest with you, at first, I was one of the people who said, I'm not getting that vaccine. Nope, I'm not getting it. I don't know what it's going to do. It's going to make me sick. And that was because I didn't have the information behind it. There wasn't enough information provided, but it was just like, hey, it's a vaccine out there that we can get. And also because of just like past things that happened in history in my community. We have Henrietta Leck, right? We have the Tuskegee experiment. And then also women who feel like when they go to the doctor, they feel that they're not being heard or they're dying in giving birth. So all those factors is like, I'm not going to be the guinea pig. And then also in studies, I showed it wasn't a lot of African Americans who were in the trial. So I'm like, I don't know if that was for me. But like I said, I trust the CDC and I trust doctors and I trust Cook's Children's. And so I'm listening to the science, and after learning more, then I can make an informed decision to get it and also inform my community, a community of childcare providers that I represent in the Dallas-Fort Worth Metroplex. So for me, it was just a lack of information and a lack of trust at first.
Mm-hmm. And now that you have that trust and now that you have that information, you still had to go through something, didn't you?
Oh, yes, I had COVID.
Wow.
I had a really bad bout of COVID in June. I would just say the whole month of June for me was a blur. I had COVID for the whole 2 weeks quarantine, and then getting over it took another 2 weeks. And then that kind of scared me. Like, if I get the shot again, I'm going to feel like that. I don't want to go through that again. Yeah. But however, my doctor, I just recently had surgery, and my doctor really sat down with me, and that was the first time he kind of explained to me. He was like, okay, you had it. So just think about it. And this is what you can think about. And he gave me resources and tools and where I can go to get the information that I needed. So yes, now I have enough information and I feel confident about scheduling an appointment to get the shot, but I had to do the research myself.
Wonderful.
So that's one of the holdups for some people.
Thank you. Imam Purcell, can you tell me what precipitated you getting, or do you have you had it, or and what precipitated you getting it?
Thank you very much for having me. And yes, I have been fully vaccinated. I was actually fully vaccinated back in March, pretty much as soon as I was eligible. Given given the fact that I'm a big guy, I was qualified because of my size. And so as soon as I found that that was true, I immediately scheduled an appointment. It took a long, well, I immediately registered, and then it took a long time before I got notified to set an appointment. Then the irony of it all is I got back-to-back invites for appointments from multiple locations that I had registered at pretty much each day. So like Thursday, Friday, Saturday, different places were giving me invites to schedule an appointment. But I went ahead and got it done early part of March, and I wound up with the Johnson & Johnson. So I was one and done.
Yeah.
So that was good. That was good to have that done. And for myself, the work I do at the Islamic Center of Irving is predominantly in outreach. So I'm very frequently out and about dealing with people, whether it's in social service settings or in just getting to meet and greet and getting to know people, and sharing information and sharing conversation, etc. So being able to have less of the social distancing that we were having to deal with was something that was very needed and necessary for my work. It makes it much easier to be able to be more relaxed about the interactions that I'm having with people as I'm going throughout my day. And so that was one factor that played into it. I was very closely monitoring the situation with COVID pretty much from the beginning of April of last year up until maybe February of this year. Every week I was checking the numbers and I was reporting it to my community, and I was trying to caution them against, being careless, being reckless, things like that, etc. So I had become kind of just by default a major source of information for our community, and a trusted resource of, what do you think? How do you feel about this? So I was keeping close tabs on everything, etc. So the science and everything else, like Jerletha was talking about, was one factor that, was necessary to pay attention to for my community's purposes. For me, it wasn't even a question. I don't have the historical issues that our African-American brothers and sisters have in regarding this, etc. I, grew up never having reason to, to question or to doubt the science or the doctors or things like that, etc. And so those factors didn't enter into my decision, and I really don't know what my decision would have been had I been in that scenario. That would be something very different for me. But because of my work, because of being so familiar with the way the numbers were going and how bad it got in our immediate neighborhood, there was no question for me that I was going to get that vaccine. And I've been having to share information about the vaccine with our community continuously. But because of the nature of our community being a religious community and being having certain traditions and things like that are very important to people, I had to also be very well versed and educated on the religious conversation around these vaccines and around the issues around this, etc. So I had to do some research around those things and share information from reliable sources to try and allay people's fears about whether or not it was permissible from a religious law standpoint, whether it was going to violate certain dietary or other restrictions in terms of things that you can take into your body and things like that, etc. So I had to stay well informed about that.
So the Islamic community was really concerned about ingesting ingredients, what it was, what it is. Can I do this from a religious standpoint, not
absolutely
from a standpoint?
Absolutely.
African American.
And to be perfectly honest with you, the resistance to the vaccine in our community is probably driven by that much more than any other sort of factor. And so that's something that we are working against. And in spite of that, thankfully, our community, the leadership in our community is forward thinking enough to take the responsible decision. So we had a free vaccine clinic 2-3 weeks ago.
Right.
And we're having another one this Saturday where we'll be providing free vaccinations to people in our multipurpose hall, in our gymnasium, throughout the course of the day on Saturday. So we're doing that.
What's been the response so far?
Last time we did it, we had 130 vaccinations were given in the course of a few hours. I don't remember exactly how long they were open, but it was about 130 vaccinations. I'm hoping that we're going to get a better response this time. There's been a little better marketing of this particular event. And as we were prepping before we went live for the call here, I was thinking about reposting some of the information I was alluding to re-present that information again to them so that it's in front of them so that they can weigh those pros and cons. But the thing that I find, because within my own family, my wife is not vaccinated and does not want to get vaccinated.
Really?
She's resistant. She's resistant of it. She hasn't really explained to me why, to be honest with you. I just know that she doesn't want to get the vaccination. I've tried to encourage her, and I've told her, like, we're going to do it here. I was like, well, you could schedule the appointment there, trying to encourage her because I knew the process so well. And she's resisted. I haven't, ignored it completely, but I've learned to have to respect the fact that this has to be their decision. Yeah. It has to be the individual's decision for whatever reason, even if it's a purely personal reason without historical context, without religious context that drives the decision. The individual has to be able to make that decision. I mean, if it had come to the point where we were mandated, obviously that would have been a different situation. Right. But we did not come to that standpoint. As far as I know, nationwide, we never really got to that standpoint, except for maybe specific sectors. Mm-hmm. But we have to respect the fact that people are going to make a decision based on, certain different factors. And we can disagree with it, but we have to be willing to respect the fact that they have the right to make that decision. And that can be challenging sometimes, but we have to understand it.
Even within your own family, isn't that something?
Even with your own family, exactly. Exactly.
You have to respect the decision, and I found that there is a difference between hesitancy and reluctance. When people are reluctant, then okay, back up. Don't push it any further. So that's again, even in our own families, we have to learn to do that. Chief Davis, can I assume that you have been vaccinated? And was there a reason behind your vaccination and what drove you to that?
Yeah, well, first of all, thank you for having me. I've been fully vaccinated with the Moderna, had both doses, was vaccinated earlier in the process because the healthcare first responders that were prioritized. As the fire chief in Fort Worth, and being a part of public safety leadership in Fort Worth, from the very early days, we've been trying to encourage folks to do the right thing and take personal accountability and respect for each other during the whole COVID response. Mm-hmm. So, understanding that, it is a, respect for your own personal position on the vaccine, I felt that as the leader of the Fort Worth Fire Department, it was important for me to lead from the front and demonstrate that I had the confidence in the science, and that, I was willing to research it and share my experience with others to make sure that they had the opportunity to get the best of the information that was available as we understood it at the time, and that I was willing to do it and I was encouraging them to do it. Yeah. I have family out of state, and I was looking forward to trying to get back to traveling to see kids and grandkids. I understand that there's hesitancy. I understand that folks believe that, this was done with a lot of speed attached to it. And in some cases, we can make the argument that the approach with the terminology warp speed, created a little bit of hesitancy. But I think that, when you really dug into the science and you really listened to people, the CDC was mentioned earlier, our local health department, we really understood and began seeing that this wasn't something that was new. This coronavirus has been being worked on for years. There was a lot of research and a lot of funding that had gone into the advancement of coronavirus research. And that once the genetic sequence was identified, that's where, the speed was actually able to take effect. So I really do believe that, we needed to be prepared to educate our folks, to get them answers to the questions that they were asking, and then provide encouragement and provide support for the potential side effects of, the general body aches and the not feeling good and the light fevers and the things that, we knew that those were actually good side effects that were indicating that there was a positive response occurring.
Right. So,
long answer to your question, but I kind of felt that it was the right thing to do. It provided me a little bit more of a sense of security, knowing that, I was not somebody that could isolate at home and do, my work from home. I needed to be the face of the organization, working side by side with other city department heads and city leadership to try to get our message out and keep our community safe.
Right.
So once again, thanks for asking.
Thank you for joining us. When you said the words warp speed, it took me back because I too heard those words, but I interpreted them as warp speed, meaning we skipped some steps.
Right.
We got it fast and we skipped a few steps, and that was part of my hesitancy because it happened so fast, and we've never had a vaccine that happened that quickly. But then again, trying to understand and getting information, like you said, we know that this has been in the works for a while. So
yes,
it was really good. It was really good. Dr. Rios, now that things are starting to open up a little bit, are you concerned that some people won't get the shot because now we're starting to get out, the sun is shining, the birds are singing, everybody's going to skip down the lane? And are you concerned that people won't get it because now we're starting to open up? Is that a problem?
Yes, that can happen, of course, because there are some people in the community that had been hesitant about the vaccine, as we were talking earlier, and they may continue to be like that, and they had been also a little bit against wearing masks, even before the CDC said that it was okay not to wear masks in those vaccinated people. So they may continue doing the same.
Mm-hmm.
But I think that's where our role is so important, as a community. And I feel that this is very important to make sure that we all understand that the vaccines are the way out from this pandemic. In the US and in the rest of the world, we have some of the best vaccines ever. They are very safe. When I first got vaccinated back in December, we had the trials and the results were pretty good. And I felt that I was getting a safe and effective vaccine. But now we are 6 months later and the data continues coming and is stronger. I feel that we realized that we were very fortunate that we got vaccines that are very effective, that are very safe, and the good surprises about the vaccines continue coming, like at the beginning we were thinking that the vaccines were good at preventing disease and mortality, and that was one of the main factors that we were taking into consideration. But now we also understand that it also prevents infection. And because of that, it's going to prevent a spread in the community. And now we not only know that, but we are seeing it. We all have been witness of that because we were at the beginning of a fourth surge. We were having the variants and the vaccines starting being administered, right, in a very fast time.
Yeah.
And thanks to those vaccines, we have now a more widespread immunity in the community. And we have been able to control the development and the spread of these dangerous variants that have been causing all these problems like in other countries, right? Like UK,
Yeah.
what's happening right now in India.
Oh,
So I think that part of what's happening right now in the US is thanks to the vaccines. And we have to thank the Trump's administration and the Biden's administration. They both have done their part, you know.
yes.
One, developing the vaccine, the studies of these 3 vaccines that we have available right now for all of us. And then the Biden's administration trying to develop a structured way of administer the vaccines as fast as possible.
Yeah.
And in 6 months, there's like a good almost 50% of the population getting the vaccine. So this is pretty, I mean, it's like I never dreamed that we were gonna be in this point
Yeah.
back in October last year.
Yeah. Yeah. It is hard to believe. I mean, at the very beginning, we were thinking, oh, this will go on for about 3 or 4 weeks. And
Yes.
then it went on, and you're like, when will it ever end? And now we're at a point where we can see
Yeah.
the light, just a pin light at the end of the tunnel. Um,
Yes.
Pastor Datcher, what are you seeing in your? I know before we got into on the call, you were talking about how busy you have been over the last few months. Tell me what you're seeing in your community.
Thank you for having me, Ms. King. We are actually, we are seeing an influx of individuals that are receiving their vaccines, as well as some hesitancy also. We still face that younger generation that refuse to receive their vaccine. And I think that's an effort that we're going to have to continue to work, and not just in this community, but all across this state and nation, and pushing the fact that it's very important for us to receive our shots and to vaccinate ourselves and to protect ourselves as well as protect others.
Mm-hmm. Anybody on the panel understand why the younger population seems to be resistant? And as old as I am, I was running, and then my son, who's 30 years old, he was toddling around and not wanting to do it at all. So I'm still grappling with why younger people are less apt to get the shot. Any ideas about that?
I think one of the areas of concern we should look at is that a lot of misinformation.
Mm-hmm.
And there's a plethora of misinformation that's going throughout social media, and they're constantly hearing some of the wrong, disingenuous information. And rather than reading and researching for themselves,
Yep.
it's easy to listen. I've had a lot of young people share the same thing our first panelist spoke about, and stated that they didn't want it going into their body. And even some of my own family members have stated that they didn't want to know what's going into their bodies, and they don't want the side effects. So I asked, do they think the side effects is greater than the death? Which one do they think would be more consequential to them? Yeah. And so I think a lot of it is just social media and receiving information. We all heard in this that was put forth on social media about 3 weeks ago that African Americans, if they receive this virus, could turn them into monkeys, just erroneous statements. Yeah. But you got those that will listen and those that will follow just because it's online, it's on the internet.
Yeah, that's really sad. That's just a sad situation. But yeah, you're absolutely right. Social media has perpetrated a lot of misinformation, and a lot of people really draw to that, and they believe it. Misty, tell me about your journey and your decision and your process of thinking with the vaccination, if you've gotten it already.
Right. Thank you for having me. So yes, I am fully vaccinated with the vaccine. And so my journey is at first I too was one of those people who's like, I'm not going to get it. I'm just not going to get it. It was too quick. How could they get something so quick? And I related it to cancer because my mom died of breast cancer, and there's not a cure or there's nothing going on in that area. So how could this, which is disease or was just as powerful as cancer, could it be vaccine for it so quickly? And so that's what was leading my thought in my family as well. Was like, yeah, we shouldn't get this. It's just not good. And so added to that, as we would have family talks and about the vaccine, and really perpetuated that thought in my mind. It wasn't until two of my friends, very, very close friends, parents died of COVID very quickly and alone. And I see the traumatic experience that those two individuals to this day still suffer from, because their parents were alone, or they talked to them on FaceTime before their parents passed away. So it hit home for me growing up with my mom dying, and I was young, and I have two young children, to say that I needed to get vaccinated, because one thing I did not want to happen is for me to die alone and my kids have to go through that. My kids having to talk to me on FaceTime as their final words. And so, and as I see my two friends go through this day after day, the anger, the sadness, the grief that they experience, it just tears me up. So I said, if I can get the vaccine and it could help me, even if I get COVID, but to help me to fight a little bit better, at least I have the tools to fight with for my children's sake. And then I wanted to show my family that I did not have any sickness. So after I got my second or my first shot, I didn't have any sickness. And I did pray and ask the Lord, like, now, Lord, I'm going to do this. I don't want no sickness. I don't want no headache, no backache, no nothing, Lord. Now come go with me on this journey. And he answered my prayer, because I did not have any problem. And so two, now I say, hey, I didn't have any problems. In my professional career, we or home visitation program working for infant and maternal mortality. We see Black women suffer on a day-to-day basis. So for me, I'm leading the way for my team, because my team is those younger people, and they like, I ain't getting it. But I know that we already service a vulnerable population, pregnant African-American women. And so I'm like, if I get the shot and I come in contact with one of our clients, I can better educate to help the clients to better understand that it didn't happen. We serve a high refugee population, and some have said, I'm going to walk backwards after I get it. And I'm saying, I didn't walk backwards. I'm not walking backwards. So I'm able to, they can see somebody from their community that looks like them, that have not had any issues or any concerns about it. So that's my journey.
Well, Misty, you mentioned your children. If you don't mind me asking, how old are they?
I have an 18-year-old and I have a 16-year-old. My 18-year-old has his first shot. Now, my 16-year-old, it's going to take us a little more work, okay? Because she's one of those that she like, at first, we were going to do it together. She was all excited. And she then listened to some family members, and they said some comments. And so then she started questioning the comments. Even though she's seen her dad, her brother, and myself get vaccinated, she's still the only one that is very reluctant. I don't want to make her get it, because I really want to have a choice. Yeah. And so I'm hoping, though, that they say you can't travel out of the country without it, because then she'll get it. So
Sometimes we need a little incentive, right?
I mean, 'cause she even said that. She was like, only way I get it right now is if I can't go out of the country and travel and I have to be vaccinated. That's her thing right now. So we're still praying and working with her and talking to her, but she's seen all of us and none of us had any issues with our doses. And so we're just hoping that will make that decision.
Yes. And I'm proud of the fact that you've made that judgment and said, I'm not going to force. I'm going to allow her to make the decision on her own. And again, as we were talking about, even in your own family, you kind of have to let that be the case. Chief Davis, now, do you get out in the community a lot? Do you see marginalized communities and how they've been impacted, or even just other folks? How have you interacted with the community, and what do you see?
So that's a great question. And very early in the whole response, we saw the issues with testing, and now the issues with vaccinations. A lot of the volunteerism in the community through the Meals on Wheels programs in some of our most vulnerable populations were impacted because volunteerism declined due to the concern of the spread of virus. Mm-hmm. So very early, there were all these gaps that were identified, and with the encouragement and the support of city leadership, the Fort Worth Fire Department really did a lot of additional things outside the traditional emergency response activities that you see us do, going to, emergencies such as fires, auto accidents, EMS runs, and et cetera. Mm-hmm. We got into, delivering meals to the elderly, and really? got into doing testing wow. in neighborhoods. We have worked with the code enforcement group to make sure that information is in people's hands in the community, worked with MedStar to make sure that stand-up clinics have occurred in different areas, be it in the Stop 6 area of Fort Worth at a fire station number 3 there, or up in the Diamond Hill area in the north end. So we've done testing. We've been doing vaccinations. We have stood up nursing home response teams that the county have identified outbreaks in certain nursing homes, nursing facilities, and extended care facilities throughout not just Fort Worth, but Tarrant County. And our folks have done over 25,000 tests in these nursing and congregate living facilities. So I'm really proud of the work and the effort that our folks have taken on. It's been a journey. It's been a big learning lesson. There's definitely fatigue setting in. Everybody's ready to get this behind them. Yes. There's still work to do, though. There's still folks in communities, but we are working real hard with other city departments and city leadership to make sure that everybody who has the confidence and wants the vaccine is available, and that those that are still unfortunately becoming ill and needing medical attention are getting tested and treated and transported where necessary, with cooperative efforts of other city departments and other agencies such as MedStar. So it's been a lot of learning on the fly as we go, and working together with healthcare agencies and the health department. And I think the Fort Worth firefighters have really maximized their opportunities to support our community. I'm really proud of them.
Yeah. Well, we are so very appreciative of all that you just mentioned, because that was a Herculean task to take on, the efforts of others who weren't able to be in there, and they couldn't do it, and you guys stepped in and did it. It's been a long year. And I'm like you, we'll be so glad when this is all behind us. I just want to ask if there's anybody. I know Reverend Datcher, you said that, did you have another clinic coming up fairly soon, or is there something at your church that you're going to be vaccinating others?
Well, we have been an active daily site Monday through Friday since the 22nd of March. And as of today, this week, we have administered over 11,000 vaccines in this community, in the Stop 6 community. And so
Wonderful.
we wanted to open the door and to make it possible where others that's in the community will be able to come somewhere close
Mhm.
to be able to receive their vaccine.
That's awesome. So do you have the Moderna or the Johnson and Johnson?
Moderna.
Okay, got it. That's awesome. Thank you so much for that effort since March 22nd. Wow. This has been a lot. This has been a lot, very much. Dr. Rios, do you have anything else you want us to know about or understand, particularly when it comes to children? How should we approach? I know Misty said she had an approach with her kids to kind of let her 16-year-old, do it. But now that we've got the 12-year-old, we've got the green light. How do you suggest we approach our kids?
Mm. Well, I think that what everybody was talking earlier is true as far as the communication and the information. It's been very challenging because this has been a new virus, right?
Mhm.
And and it's been a new condition. So the information has been evolving over time, and we have been learning over time, and there have been mistakes, or not mistakes, but there are been like misconceptions. I think that we should do this. Then 2 weeks later, no, maybe that's not the right thing. Maybe we should do that.
Yeah.
And there's a lot of back and forth that is even confusing for us,
Mhm.
not only for the community, for the public, but also for doctors, So what finally, what is it that we're supposed to say or do or that? So we have to understand that people have doubts and questions, and they may be confused, and they may have their own sources that may not be the best, as we were talking earlier, right? They may be reading in the internet certain things, in Facebook, Instagram, you name them. So we
Mhm.
need to approach people, and I think that we do need to try to have that conversation with our parents and with our patients,
Mhm.
and ask them what questions they have, what they want to know, and be there for the community. And that's what we're trying to do here in Cook with our patients that come for different reasons, right? They may come for something different, but we try to bring this up.
Mhm.
And we talk about the vaccine. And some parents are already vaccinated, and there are some that are hesitant. And it's not the typical anti-vaxxers. It's
Yeah.
different.
Right. Right.
People that really are confused, and
Yes. Yes.
they just don't know what to believe,
Yeah.
and because the information out there has been confusing, we
Mhm.
have to admit it. So we have to be there, and we have to be available, and we have to try to answer all the questions, and we have to be honest, when we don't know the answers. But it's the best that I can say, that we have to
Mhm.
be up there, and that for the kids, um, we have to be available for them. We have to open the conversation and let them ask, and not to put any shame in people
Right.
because they don't want to do it.
Right.
Just let them have the doubts, let them have the questions that they want to do. And maybe eventually they'll realize that their life is really going to be better, because I personally, what everybody's talking, I love being able to go and see my elderly parents and
Mhm.
give them a hug and know that I'm not going to infect them. And I want to go to the gym, and I want to, go to the movies. I want to live. And then many of the younger population would like to do all those things. And if they understand that the vaccine really give them that passport or
Right.
that.
Do that. And we need them back in school, quite frankly. I mean, there's so much studying that has been going on about these kids being out of school and being away from their friends and being away from in person learning and how that has impacted them. And not only that, but their mental health. My goodness, some of the things that they are experiencing. Even as we sit here at Cook Children's, we know that suicide has gone up. The attempt of suicide has gone completely up through the roof, and it's really difficult. So we want to encourage those kids to do to have the questions. By all means, we don't want to shut them down, but we want to encourage them to talk and to communicate and ask their questions, but try to persuade them to get the shot so we can go to the movies. I need to go to the gym. I've gained 20 pounds and need to do that. So it's really something that we really need to be thinking about, being vigilant and being persistent. You know, this has been so. Is there anything else anybody has thought about, or anything that, any last thoughts that they'd like to maybe express or say before we jump off?
Can I say something very quick?
Sure.
That we had been thinking that pediatrics, that the patients don't get very sick. And then some parents are questioning about this. What about, I mean, do we really need to give vaccines? Kids don't really get sick, but they do. Sometimes they do. And there's no way to predict who is going to get sick, you know, or who is just going to have a little like cold. We can't. And I was telling you that the vaccine has been giving us nice surprises over the course of the last few months, but at the same time, this virus continue giving us bad surprises, you know, and we know that there are people that do vasculitis, bad inflammation of the, you know, the arteries, or autoimmunity, and we don't know who's gonna do that. We have some kids in cook children that have been very sick,
Very sick.
intensive care unit, and I guess that what I want to say is that the vaccine will prevent some of these kids from being admitted to the hospital and will prevent some deaths in the pediatric population. And also, by decreasing the amount of infection in pediatrics, we continue controlling this pandemic and hopefully bringing the numbers down more.
That's exactly right. That's exactly right. And we need to keep it down.
Yeah.
Thank you very much. Anybody else? Anything else that you would like to add to that before we jump off?
I'd like to just, if I could, jump in real quick.
Please.
Just, I want to thank everybody here, Winnie, especially for organizing this, and the rest of you for participating. This is so incredibly valuable. I mean, when you look across the screen and the diversity of participants in this conversation and the diversity of perspectives and everything else, this is amazing. This is fantastic. These are the positive outcomes of this tragedy that we've seen, where people have come together and recognized our common cause and our common purpose and need, that we've been able to join hands and work even in the midst of a pandemic to serve others. So you see us all here. We've all spoken our piece about this. I encourage everybody that's watching this and has a chance to see this once the recording has been posted, let's get better together.
Yes. Very well said.
Ms. King, I would like to add, I learned something more, some more information that I can bring back to my community, thanks to the Fort Worth Fire Chief.
Yeah.
I did not know that this vaccine has been in the works for, before COVID. I didn't know that. And so that, and like you said, it's like we thought, oh, they came up with this so quickly, maybe that's why, that's one of the reasons they were able to kind of come up with the vaccine quickly, because it's been in the works. And that's another thing that we're like, man, this, they came with this too quick, so I can go back and say, hey guys, did you guys know that, this been in the works, so
exactly.
Thank you.
Exactly.
So, yeah.
And thank all of each and every one of you. You all bring so much to the table and have assisted our community so much and so well. And you've been so incredible during this year. It is so much, it's wonderful to see the coming together for a common cause. So again, I want to express my thanks, and thank you so much for what you do every single day. We'll see you soon.
Thank you.
Take care.
Thank you.
Thank you,
Bye-bye.
you too.